list of skills is calcaneal active range of motion, inversion, eversion with a goniometer. Second one is cut testing, knee flexion. Third is mobility testing, tibiofemoral distraction. The fourth is joint mobilization, distal tib fib, posterior joint mobilization. And 5 is Lockman's or modified Lockman's. So I'm going to have these to the side so I can refer to them. All right, so the first one. So hi, Ms. Bouton?
Yes.
My name is Celia Bouton. I'm a student physical therapist. It's nice to meet you.
Nice to meet you.
So I'm just going to go over a few things that we're doing today. We're going to be looking at some strength and range of motion of your knees and your ankles. Does that sound good?
Yes, that's fine.
Okay. So what I want you to do first is, if you don't mind, go ahead and make sure if you'll take off your shoes for me, socks and shoes. I'm going to be looking at the range of motion in your ankles. So you're able to move your ankles in and out, just like this.
Okay.
And I'm going to be looking at that. So I'm actually going to have you lying on your stomach for me. Yeah, that's fine. And if you don't mind, I'm going to have you, so this isn't the most ideal area I want you to be, or like bed that we would use, or couch, so to speak. I'm going to have you actually, can you scoot forward a little more toward your feet? I don't know. This way? Yeah. So what I want you to do is I want you to just bring your foot in and out, just like that. So I'm going to come stand right here. Okay, can you do that again? And out. Good. And can you do that with this foot? Good. Okay. So before I do measure this, actually, can I have you sit on the edge of the, and I want you to just bring your, just bring your ankle in and then out towards me. Okay? Good. And the same thing on this side. Good. So you have a lot of inversion. I'm going to measure that now. So I'm going to have you lie back on your stomach for me. So you can relax your legs. I'm going to do your measure your left foot first. So if you'll bring your foot in first and relax. So I'm measuring along the midline of the calf, placing the axis on the the Achilles, and go ahead and move your foot in for me. So you have 24 degrees of inversion. Okay, you can relax. And now you can take your foot out for me. Go ahead and leg in. Okay, and you only have 8 degrees of eversion. So a little less ability to move your foot out, but you are supposed to have less movement as you move your foot into eversion. So on this foot, I want you to go ahead and move it with, just a second, sorry. Move it in. Same thing, lining it up on the midline of the calf. 22 degrees here. And then 8 degrees of eversion here. Okay, that's our first. You do have appropriate amounts of inversion and eversion in your ankles. And then the next skill I'm going to be looking at doing is I'll have you lie on your back for me. You can just flip on over. Alright, and I'll start with your, since we started with your left leg this time, you can relax your right leg. So I'm going to have you just like this. I don't want you to let me bend your knee more, okay? Or sorry, I don't want you to let me pull your leg up. So you're going to hold it here. I just want you to resist as much as I'm putting pressure. So I don't want you to try to overpower me in any way, okay? And I want you to let me know if you have any pain or any symptom you production of any kind with this, okay?
Okay.
Don't let me pull your leg. Pull it here. Okay, any pain there?
No.
Okay, same thing on this side. Relax it just a little bit more. Alright, and hold it here, don't let me. Good. Any pain?
No.
Okay. Next one is tibiofemoral distraction. So, I want you to just lay like this. I'm just going to be applying the force outward or downward toward me. I want you to let me know if there's any pain with the pressure that I'm applying, okay?
No. No. No.
Feels like you have a normal, appropriate amount of motion in that ankle. And it's equal on this side of me here.
No.
As well. The same on both sides, which is what we want. And then I will look at how you, see, can you potentially go ahead and bend your knees up for me, actually, yeah. So this is distal tib fib joint mobilization, and I'm going to, let's see if this is going to be, I'm going to start on this leg, and then I'm going to actually have you flip where your head is over here, because it's going to be really hard to do it, to perform the joint mobilizations on your left leg with it on that side, okay? I don't want you to do anything, okay? Any pain with this?
No.
This is just posterior mobilization. This helps with bending at the ankles when, say, you were going in for doing a squat or anything like that.
Mm-hmm.
No pain here.
I can feel it on the inside.
Feel on the
My
inside
foot.
of your ankle.
In my,
This
it
one?
kind of shoots out to the foot.
Shoots out. So that's probably, I might be on a nerve. That's probably what that is.
Okay.
How about, you
Nothing.
still feel it? Okay, good.
Nothing.
Still nothing?
Nothing.
Okay, good. Alright, so I'm gonna actually have you flip to where your head is over here now. Same thing on this side. I want you to let me know if you feel that same shooting pain, because I don't want to be on your nerve.
Okay.
Any shooting pain?
Nothing.
I can also, there's 4 different types of mobilization. So grade 1 is just more for pain purposes. Grade 2 is a little deeper, and it's for pain purposes. If I wanted to try to get stiffness out, I could go to a grade 3. And then grade 4 is the end. Okay. Any pain?
No.
Okay, the last skill or
My
test.
stomach growling.
The last one is going to be the Lockman's test, and this is looking at the integrity of, have you heard of your ACL, the different ligaments that connect your knee, connect inside of your knee? So this is looking at the integrity and structuring of both of your ACLs on both knees. So I'm going to have you, just like this, right here. And I'm just going to, any pain there?
No.
Okay, no movement, which is good. And if you don't mind, sorry, I'm gonna have you turn around again. And there's no excess movement either, which is what we want. No pain?
No.
No excess movement, so that's a negative on both knees. And that is, so I'm done with all the skills that I need to, tests I need to perform on you.